on the street, arm might be shoulder to fingertip, but in A&P land, arm is only going to be shoulder to elbow. So if I ask you to list me a bone in the arm and you put the shoulder, that's not in the arm, that is in the forearm. So very different location anatomically. So we've got the arm, the sciencey way to say it is brachium. We've got the forearm or antebrachium, and anti is opposite, so opposite of the arm is the forearm. We've got the carpus, that's the wrist, and we've got the manus, which is the hand. So starting with the brachium, your arm from shoulder to elbow, it is going to have the single bone in it, so just the humerus. So if you eat your chicken wings, this is the single-boned chicken wing, not the flats with the two bones in it. That's their forearms. So our humerus does not have an O in it. So if you try to type it in Word, it wants to make it funny. It's not funny. There's no O. So it's not ha-ha humerus. It's humerus without the O, without the funny. Now, as we mentioned in our previous test, this is one of two locations in long bones that we do have blood formation. So the proximal epiphysis of the humerus, proximal epiphysis of the femur, we're going to have red bone marrow for blood production. All of the other blood productions are going to occur in the axial skeleton versus the appendicular skeleton. Our hallmarks or landmarks that we have, again, we have the deltoid tuberosity. Apparently, whoever's arm this is was much more built than our lab guy. So you have that big bump on the outside, and that's the attachment point of the deltoid. So the bigger your deltoid, the bigger your deltoid tuberosity would be. So it's one of those rare cases where we have the muscle attaching to the diaphysis and not the epiphysis of the bone. The radial groove is going to be a little dent that is going to kind of protect the radial nerve. So it gives it a little bit of protection against bumps and so forth. At the end of the humerus, you're going to find the ulnar nerve. That's some people call the funny bone, and that's how it got its name. It's at the end of the humerus, ha-ha, funny bone. So again, that one feels weird because it's one, not a bone, it is a nerve. So when it misfires, we don't like how it misfires. We don't like the feeling that it sends to the brain with that processing. Ooh, it's like a humerus. Ooh. Antebrachium, the forearm, elbow to wrist. We have two bones found in the antebrachium. Again, we start with the ulna when we are in anatomical position, palm forward. The ulna is medial to the radius, so it's along your pinky. It is roughly triangular, and again, this is where you're going to have to use your imagination. It does have a little head and a big butt, so that does kind of make it look slightly triangular. Now, when we look at the radius and ulna, of course, they sit next to each other. They articulate with each other. They are going to have this interosseous membrane. This is a really wide ligament attaching the lateral border of the ulna to the medial border of the radius. That keeps these two bones together. We don't want them to separate because if they separate, that's going to cause a lot of damage. Nobody wants to split their forearm, right? Traumatizing. Okay, for many, many reasons. But they're going to be kept together. That way, as they move around, they move as a unit, and they can move within relationship of each other without damaging each other. Now, with the ulna, as we've mentioned, it is the only bone to stand on its head. All of your other long bones, the head is going to be proximal. So the head of the humerus is in the shoulder. The head of the radius is in the elbow. The head of the femur is in the hip joint. With the ulna, its head is by the pinky, so it's upside down. So it's considered the head because it is the most small tapered portion of the ulna. And they just couldn't justify the other end with the O'Cranon process and such being the head area. So its head is down by the pinky, and that is somewhat helpful when it comes to memorizing their positioning because your pinky is little, the little head of the ulna is by the pinky, the big butt of the radius is by your thumb, and your thumb is bigger, so it can be helpful that way. So that is your ulna. Radius along the thumb, again, that's where your radial pulse is. It's that blood vessel sitting right on top of the end of the radius. So when it pulsates, you can feel it pushing through your skin because it can't push down into the bone structure. So it's going to be that wide end by your thumb area. It will articulate with the ulna at the ulnar notch, and the ulna articulates with the radius at the radial notch. So not only do they have that membrane to keep them together, they do have little notches that fit together, kind of like Lincoln logs, so they can work around each other. And its head is fairly flat, kind of like the head of a nail, and it's up by the humerus, specifically the capitulum of the humerus. And that's how the capitulum got its name, because cap like decapitation. So the head of the radius fits up into that area. Look at that, it's like a radius and ulna. The wrist or the carpus. Again, we have 8 carpal bones in lab. Obviously, we need a lot more detail. We need to know all the nooks and crannies of the bones. So in lab, we need to know all 8 of them. In lecture, we just care about 2, and they're the ones that have something fancy associated with them. So the capitate, that is the largest of the carpal bones. So again, cap meaning head. So that's going to be the biggest one. So it's the head bone. It's at the base of the middle finger there. And of course, we have the pisiform, which is a sesamoid bone. It's sitting inside of the tendon that goes from the muscle in your forearm to your pinky, so you can bend your pinky. So that is the only sesamoid bone in the carpals. So that's what its little claim to fame. Look at that, there's a hand. And again, in lab, I will always show you palm up so you can see all 8 carpals. When it's palm down, it's hard to see the pisiform. It kind of peeks around the triquetrum. Yes, sir.
Okay, I was just going to ask, where's the pisiform?
Yeah, this one is not a very good picture because of the angle at which they took it, but it's kind of peeking in this individual. It is palm down, so you can't really see it well. One of the easiest ways to see palm down is look at your thumb. See how the curve is here, so it's a palm downer. That's why I don't show you palm downs. You kind of have to pretend the pisiform is visible. Metacarpals, again, we've got 5 digits, so we've got 5 metacarpals. Those are the long bones that make up the top part of the palm, the beginning of the hand proper. And then we have the phalanges. Again, phalanges is plural, phalanx is single, because you can remember your X is always single. So we have 14 phalanges. Your thumb, that is scientifically called the pollex, only has 2 phalanges, the proximal phalanx and the distal phalanx. Everybody else has 3, proximal phalanx, middle phalanx, and distal phalanx. And there's a hand again, palm up, so you can see all the carpals. The pisiform sits right on top of the triquetra. That's why you might have noticed in lab the skeleton hands, they're fused together because it was cheaper to make the mold just with both bones instead of separate bones. When you look at the disarticulated hand, they cut them off so you can see that they're separate from each other. And here's palm down. You really can't see the pisiform well because it's kind of tucked up and under. The pelvic girdle. Okay, so the job of the pelvic girdle again is to attach the lower limbs to the body. Now our pectoral had 2 functions. Our pelvic has 4. Now, obviously, the 2 we do share. So the first one is attaching the limbs. So attaching the lower limbs to your axial skeleton. So the sacrum is going to attach to the ilium so your legs don't fall off, because you know that would be awkward. So that's one shared function, attachment point. Another shared function is going to be muscle attachment. So we have lots of muscles. That's why we have all the knobs and doohickeys and funny looking angles and so forth on the ossa coxa. We've got hip muscles, we've got ab muscles, we've got back muscles, lots of different muscle attachment for the ossa coxa. So those are the shared. The 2 functions that the pelvic girdle has that the pectoral does not. First and foremost, transferring body weight. Okay, we walk on 2 limbs. So that means our ossa coxa has to be much larger, much bulkier than our clavicle and sacrum because it's dealing with the weight transference of the body to the lower limbs. If we were looking at cats and dogs, they look almost identical. They look not so much identical, but very close in size because the equal distribution. There's a big discrepancy. Our ossa coxa is huge compared to our scapula because of that weight transfer. And the final function that we have in the pelvic girdle that we do not share with the pectoral is protecting of organs. Okay, so your clavicles in the front, there's not a lot of organ going on there. Your scapulae are behind your ribs, so they don't protect your lungs or heart or anything like that because that's the job of the ribs. With the pectoral girdle, there's no kind of organ protection with those guys. With the pelvic, you've got them encasing and surrounding a lot of the components of the pelvic cavity. So you're going to protect the bladder, you're going to protect the large intestines, some of the small intestines, the uterus if you happen to have one. So the ossa coxa is going to help protect damage from the sides, from the back. So hopefully so you don't damage or rupture anything within the organs there. Yes, sir.
One more question. So the pelvic outlet, what was the name you had for that? The giant hole in the center of the...
So from this side, it's the inlet. From this side, it's the outlet. Altogether, it's the brim. Okay. With the brim of your hat. Okay. So that leads us to the pelvis. So pelvis is not a bone, okay? So you can't say pelvic bone, that's not my pelvis. That would be like saying that's my unicorn, it's imaginary. Pelvis is a region of the body that incorporates multiple bones, that incorporates different parts of the skeleton. So the pelvic region is going to have components of the axial skeleton, like the sacrum and the coccyx. It's also going to have components of the appendicular skeleton, the ossa coxa made of the ilium, the ischium, and the pubis. So the pelvis is a region, not an actual bony structure. So it's not something I can point to and go, what is this bone? It would be, what is this region of the skeleton, or what is this area of the skeleton? But it would not be the bone structure, because it's not a bone. So here's a dude, and he has ossa coxa. So again, the ossa coxa made out of the ilium, the ischium, and the pubis. And this is showing you a whole picture of the pelvic region, so we can see it does include the sacrum and coccyx to help protect those organs. And we notice that this is a guy because he's tight, so narrow hips, could not birth anything through that thing. Okay. So the ossa coxa, in your lab book, unfortunately, it says hip bones. And again, we don't accept hip bones, just like we don't say leg bone, arm bone, knee bone, because we're adults and we're paying for a college class, not a first grade education. Another reason we don't use the word hip bone is because hip is the joint. Okay, it's the same reason why we don't say elbow bone or shoulder bone or knee bone. Those are joints, not bone structures. So the hip is not a bony structure, a bone specifically. It is a joint found between multiple bones coming together. Another term you may see in the wild, if you're doing comparative anatomy, looking things up, is the term inanimate bone. This is a term we often see more associated with animals than humans. So you may see this term if you were to take comparative anatomy because you want to switch gears and be a doctor instead of a nurse. Inanimate is a Latin term that means we don't know how it got here. So it's basically the science way of going, poof, it appeared. We now know how they form, the developmental stages and so forth, but in the very beginning, they didn't quite understand how did the bones get fused the way they did and how did they form the way they did. So that's what the term inanimate means we're not sure how they happened, even though we now know. Now, as mentioned, there's lots and lots of muscle attachment. That's why there's so many spines and processes and all kinds of craziness for muscles to attach to. And the ossa coxa is made out of 3 bones that have fused together, the ilium, the ischium, and the pubis. Okay, so the ilium, that is your big fan portion of the ossa coxa, so the most notable large part of the ossa coxa. It's what keeps your pants up if you're wearing normal pants. If you're wearing pants below this, shame on you, pull your pants up, you're an adult, right? The only time low riding pants are fun is when you watch cops and then you watch them try to run from the cops with their pants around their knees. Like, you know, if you pull your pants up, you can run. Right? But anyhow, keeps your pants up, put your kid on, that kind of stuff. This is the only part that articulates with the axial skeleton. So the ilium and the sacrum come together. So the ischium and the pubis don't touch the axial skeleton, just the ilium. So this is where we're going to be transferring our body weight from the axial to the appendicular. It's why the ilium is so large compared to the other two. It's dealing with weight transfer, dealing with the weight of the body. Now, one of the big noticeable hallmarks or landmarks we see in this is the greater sciatic notch. That's this big hook back here. Makes a really good way to hold the little guy. The greater sciatic notch gets its name because that's where the sciatic nerve passes through. So coming from the sacral region, it passes through there before going down into the lower limb. And this is why so many people have problems with sciatica. There's not a lot of protection for that major nerve coming through. So if you sit wrong, it's going to pinch that nerve because the only protection it has is actually fairly high up in the hip area. So it's not going to be low down where it could be bumped and bruised and so forth. Okay. And there's this guy's ilium. Ischium.
Can you show me one more time? Yep. Okay, cool.
The ischium, that is the back part of the circle, so to speak. That is what you sit on. So you remember the ischium and the tushy, they both have a sh associated with them. So what you specifically sit on is the ischial tuberosity, the big rough spot on the ischium. So when you're sitting on somebody's lap and they say, oh, your tailbone is digging into my leg. No, it's not. Your tailbone's much higher up, right? Your coccyx is up there, usually about 3 or 4 inches higher than the ischial tuberosity. If you can't find your coccygeal bone, you find the top of your butt crack. That's where that bone is located. You do this in the privacy of your own home. Do not find those structures in public. But again, if you were sitting and they're like, oh, your tailbone is digging into my leg, in order to do that, you'd have to kind of lean back and rub. Now, I don't know what you're doing, but unless you're rubbing, it's not your tailbone. It's going to be your ischium. That's what you're sitting on, which is ironic because that area actually doesn't have a whole lot of meat associated, which is why sometimes your butt goes numb if you sit for too long on a hard surface. Your meat's above that. And you're like, well, the cushion should be shut down, but apparently not. Yes, ma'am.
So whenever I'm kind of sitting on your lap, is that the bone that you feel?
Yeah, when you got a bony butt, that's the ischial tuberosity. Crazy kiddos. But don't let them sit on you. Used to it. I don't know. They hit teenage years and then they just hiss at you if you walk by, right? My son stopped hissing at me. That's great. All right, some of our hallmark areas, we've got the lesser sciatic notch. If you blink, you're going to miss it. It's this little guy right here under the ischial spine. So the lesser sciatic notch gets its name because it's below the sciatic notch. Okay? It doesn't touch the sciatic nerve, doesn't have anything to do with the sciatic nerve. It just happens to be a tiny notch under a big notch. So it got the name lesser sciatic notch. Now, there will be some little blood vessels and muscles that pass by it, but nothing impressive like the big boy on top. And there's your ischium, the back part of the circle, what you would sit on. And then we have our pubis or pubic bone. So that's the forward portion of the circle. That's what's going to hit if you hit a boy's bike, right? Because boys' bikes make absolutely no sense, right? You've all seen boys' bikes? They're the ones with a big bar. It does help you to learn how to ride better because there's an incentive not to fall. And that's what they had to do with me. It's like, oh, you can't ride a bike? Here's a boy's bike. Enjoy.
Good Lord.
Yeah. Got a little taller, able to keep my balance a little better and worked out. So that's the forward portion of the hip area. Now it's going to have the pubic symphysis. So the ilium never touch each other, the ischium never touch each other, but the right and left side of the ossa coxa do come together at the pubic symphysis. So the two pubic bones have a joint between them. And this is an important joint because this is the only place we have any kind of wiggle room. So when you give birth to big-headed babies, this is where we might wiggle to gain a little bit. So depending on you and your stretchy ability, you may gain about a half a centimeter there. So even after you give birth and you know, if you lost all of your baby weight, you can just like, I weigh the same, but my pants need to be bigger. It's like your kid spread you, okay, at that pubic symphysis. That's the only place you can wiggle for their big old head to get out. And there's this dude's pubic bone. The pubic symphysis in between. All right. Other areas, we've got the obitural foramen. That's the hole. Okay, so that big hole that the bones kind of ring around. There's ligaments that go through there, blood vessels, and so forth. We have the acetabulum. That is the socket or the cup that holds the head of the femur in place. The acetabulum has all three bones, so the ilium to the top, ischium to the back, and the pubis to the side, making a little three-way cut of the pie piece there. The term acetabulum means vinegar cup because apparently when they were first dissecting people, they thought it was something that looked like you could put some vinegar in so you can dip your McNuggets in. It makes you really worry about the people that were labeled. Who's like, you know what? That would be great to hold my barbecue sauce. But that's how it got its name. Acetabulum means vinegar cup. Yes.
Can you pronounce is it appendicular foramen? How do you pronounce
Obitural foramen.
Obitural?
Yeah, and I cannot guarantee that is even pronounced.
Okay, cool.
Because I don't like that. So your acetabulum. Some people remember acetabulum because it helps keep the tabs on your ass. That never works for you as long as it's legal. So false pelvis versus true pelvis, possibly labeled on your bonus that you just turned in. If it wasn't, you got a slashy mark. So the false pelvis is going to incorporate just the upper blades of the ilium, so only one bone type there. It is called false pelvis because it does not have the pelvic cavity. It's officially not protecting your organs. It's just there for muscle attachment. The true pelvis is down lower than the false pelvis, and it will contain all three bones, the ilium, the ischium, and the pubis, and it is in line with your coccyx. So if you touch your coccyx and draw a circle, that's going to be the top border of the true pelvis. And it's the true pelvis because it has the pelvic cavity. So that's where you can find your bladder and your lower parts of the large intestine, small intestine, uterus. Yes.
So the iliac crest, a little bit below that, you said is the false pelvis?
Yeah, so right about here is your dividing line.
Okay,
So false pelvis, true pelvis.
Gotcha.
So if we were to look over at this dude, it'd be right here. And you can see the cavity sitting right
okay.
Up
Gotcha.
here, we don't protect nobodies.
False pelvis, okay. Thank you.
So, as we've mentioned in lab, and of course we had our lovely dunking of the baby head example, there are differences between males and females. And again, these differences start when you hit puberty. So up until then, all kids look exactly the same. That's why if you ever watch TV, whether it's mass graves because of war or because of archaeological digs or what have you, they always talk about the remains they find are men, women, and children. They don't identify the sex of the children because there is nothing biologically different while you are still little. You haven't had testosterone or estrogen, so that's not going to drive a lot of the big differences between the males and females. So once the kid hits puberty, that's when you'll see those differences start to appear. So testosterone stimulates bone growth, testosterone stimulates muscle growth way more than estrogen. Bigger muscles pull on bones more, and the more you pull on the bone, the bigger the bone's going to be in response to that. So again, guys usually have bigger bones because they have the bigger muscles to pull on them. Estrogen will make your bones grow really fast, but it doesn't add bulk to muscle and it doesn't add a lot of bulk to the skeleton. But you will have those variations and changes. So whenever we find bones out in the wild, whether it's a crime scene or archaeological dig, there are certain bony components they want to find. They always want to find the ossa coxa because that's the easiest way to tell if it's a male or a female. Secondarily, they do the skull and the knee joint, which is kind of kooky. So our things that girls have to have or modified so they can give birth to big-headed babies. The first one we have, of course, is wider. So that's why we have that term childbearing hips. You're going to have broad, low ossa coxa whenever you are a female because your true pelvis is bigger, your pelvic cavity is bigger because you have to hold a baby in that cavity for a while whenever you get pregnant. So we're going to have bones to accommodate that larger cavity size and the presence of offspring. Where guys are going to be high and tight because they don't carry any babies. They don't have to have a wide cavity because there's nobody there hanging out. The curvature of the sacrum and coccyx is going to be different. So if you're a guy, their curve actually curves into the true pelvis. So if you do a side shot, you can actually see the coccyx actually sitting in the pelvic cavity. So again, when we did the little example, the baby head just could not get out. Awkward. In the girls, it's going to curve back. So it's going to curve away from that true pelvic region because those big-headed babies have to pass through there. So if we put our imagination hats on and said, oh, well, this guy's going to try to give vaginal birth, pretending, it's just not possible. Even if you were to give a guy a uterus for the hell of it, I don't know, who would want one of those, right? Who volunteers? Nobody. But if we were going to give a guy a uterus so he can get pregnant, of course, you might want to give him an exit port so he can try to kick it out. It wouldn't work. You would have to break off things. So in order to give vaginal birth, if you were a dude, you would actually have to break off the bottom part of your sacrum and coccyx, causing massive internal bleeding and damage. Also to the baby, because he's going to be head first into a bunch of bones. That's not going to be conducive to survival of that offspring. So that curvature is in a different location because, again, you're giving birth. And that's why guys usually have flat butts and girls usually it sticks out more because that curve sticks out to get them out of the way. Lighter, as mentioned, bigger muscles pull on bones more. The more we pull on bones, the rougher those bones are going to become, the heavier those bones are going to become. So anytime we see terms like heavier, rougher, more pronounced bone markings, that's usually a male. Lighter, smoother, less pronounced bone markings, that's usually a female. So some of the bone markings we point to are really hard to see on female skeletons when they're very obvious in guy skeletons because of muscle mass and those changes. Rounder. So again, when we look at the pelvic inlet and outlet together, it's kind of round down there in girls because of the way all the pieces come together. In guys, it's kind of heart-shaped. Isn't that adorable, little heartsies? So now you can now sex your skeletons that are cartoons. So if you look at cartoon skeletons, sometimes they have a heart down there, sometimes they have a circle. So if it's a heart skeleton, it's a boy. And if it's a circle skeleton, it's a girl. Isn't that fun? Now you can sex them too. Usually the cartoon people aren't going, I'm gonna make boy skeletons today. They just look at whatever they look at, and the odds are they look at a male skeleton. So I want to say those dancing skeletons from the this one that does this weird stuff with its black and white, they're boys. So you can look at them and identify those little things. So, fun things to share with your friends and family. Pelvic inlet and outlet. Again, the pelvic inlet is the opening between the two sides of the ossa coxa if you're coming in from the anterior side, inlet, and the outlet is the posterior side, just like we saw the posterior and anterior sacral femina. Altogether, it's the pelvic brim. Kind of like the brim of your hat sits on your head. Ironically, when you're giving birth, briefly, you're a little hat for your kid. So this is, again, wider, rounder for birthing. This is the birth canal. So when they talk about kids being stuck in the birth canal, this is where they're stuck. They can't get from the forward to the backward position out properly. The pubic angle, again, because they're high and tight and narrow, they're going to have a small pubic angle, less than 90 degrees. Women with their broad, low childbearing hips are going to have a bigger angle, greater than 100 degrees. And then we've got the hormone relaxin. So relaxin is produced usually by the placenta. And this is one of those hormones that you'll see in girls, but you won't see in guys. There's only a few hormones that are that way because they're associated with the birthing. So relaxin got its name because it relaxes the pubic symphysis. So it actually targets all cartilage in the body. And this is what we talked about last week, why you got to wear shoes when you're pregnant so your feet don't spread, and how you get lordosis or kyphosis if you have bad body posture while you're pregnant. The big job is to get to this area because, again, that pubic symphysis' job is to keep the two pubic bones held together tightly, which is not conducive for getting the kids out. So as you get to the later stages of pregnancy, you're going to get more and more relaxin. That's going to loosen up that pubic symphysis so it can eke open a little bit. So those big-headed kids can get out. And then after you're done, it dissipates and your pubic symphysis will retighten, but not all the way to pre-pregnancy state. So this is why if you've ever, again, news or TV shows where they're like, we found skeletal remains of a female and we think she's given birth in the past. And you're like, how did they know that if it's a skeleton? It's not like the baby wrote, I was here on the way out. What they do is they measure the pubic symphysis. So women who have never been pregnant, it's really tight. It's almost boy tightness. And then if you've been pregnant, it's going to be a little looser. If you've given vaginal birth, it's going to be even looser than that. And if you've had multiple kids, it's going to be really wiggly. This area is also one of the reasons why we have different standards for athletics and activities in males and females. So, you know, back in the day, like the Army, guys had to march this far and had to be able to do this, where girls did less. And you had a lot of uneducated people thought, that's not fair. That's sexist. We're all equal. Oh, honey child, y'all are not equal. Boys and girls are different, and they have different jobs. Our skeletons are different. Our muscles are different. So what would happen if you made a girl soldier march as much as a boy soldier? It would actually cause inflammation of the pubic symphysis because the way the pubic bones come together. So it can cause severe, basically crotch pain, shooting, paralyzing pain, to the point that some women had to be discharged from the Army because they caused permanent damage to that pubic symphysis trying to march like a man. So there are differences in male activities and female activities. It's just not sexism. We're built different. And if you try to make something do something that it's not built to do, it's going to damage that thing. Okay, so this is why girl soldiers don't have to march as much as boy soldiers during basic training. It's because they're built different, and you don't want to break the girls just to prove they're man enough to be in the Army. It's kind of self-defeating because you're not a man, you're a girl, and you're going to be built different for that. And we'll get into that a few more in a couple of slides. But you actually have different components, different angles of the knee, and so forth. So girls athletes are more likely to have certain knee injuries to boy athletes. So you'll have certain knee injuries that you'll see more in the WNBA. That's their letters, right? Mm-hmm. Girl basketball people versus boy basketball people. I don't do the sports thing. I don't care. Okay. But again, different injuries if you're a girl versus a boy, even doing the exact same sport, even if you were playing co-eds. It's because of angles in bone structures. So you can actually tell a girl knee from a boy knee based on stresses and angles. So it is kind of kooky. You can tell a lot from a skeleton. That one always there used to be a meme back in the day, and it was an X-ray of two people kissing, and they're like, "Look at that! Isn't that beautiful? All you see is the bones. You can't tell if it's boys or girls or whatever. We're all just equal." And then there's somebody that goes, "Actually, you can tell from the skeletal components that this is a European male is blah blah blah, probably this 6 feet. This is an African female because of blah blah blah." And it's like, so you can tell the sexes and the ethnicities by different bone structures. It's like, it's because science. We don't get along with the artsy people. Aren't we all equal? No, we're different. It's called sexual dimorphism. Every mammal has it. We're different because we're made to do different stuff. Trust me, if we could pass off birthing to the other guys, we would. It's like, here, take it. We'll take peeing standing up for 1,000 hours. But gotta have some differences. Gotta do the girl things versus the boy things. Did you still have a question, or did I just talk past him?
I think you answered it pretty much. You answered it.
So there's our couple. So they look so happy. It's because of the angle. Makes it look like they have smiley faces there. So here's our dude. He's high and tight. Okay. Here's our lady, low and broad. Again, our angles much wider in the females than in the males. Here we can see the heart-shaped pelvic inlet and outlet created by the tightness, the closeness between the ischial spines and the sacrum and coccyx curving in. Here with the female, much rounder, because again, round-headed babies instead of heart-shaped headed babies. Further apart on their ischial spines, and the sacrum and coccyx are curling backwards. It's kind of hard to see because it's a two-dimensional picture, but that's why we can't see all of that parts of the coccyx on the male versus the female. It's showing the curves in. And this would be normal standing position. So even at normal standing position, she does tilt forward a little bit. So females are slightly bowed to help with protecting and all that kind of fun stuff. So that's why her sacrum looks a little different than his sacrum, is because of position in the normal standing. Differences between the boys and the girls. So here's our dude. So we know this is a guy because he is high and tight. He's got a heart-shaped inlet. He's got a very tight pubic symphysis. He hasn't had vaginal birth. And if you squint, you could actually see a penis right there. So that's a dead giveaway. You can also see the head of the acetabulum, or where the head of the femur fitting into the acetabulum has a slightly different angle. With girls, since they're wider apart, you're going to have a different angle here. Okay, so craziness. That's why you see more hip replacements in females. Strain and stresses because of the angle there. Same dude, just showing you the brim, okay, where the bladder's hanging out. And hey, hopefully I'm protected and don't blow up for you. Right? Leading cause of death from car accidents, popping bladder. Isn't that fun? Not for the person, obviously, because death. But when your bladder explodes, it can be quite a mess on the inside. Usually also indicates major trauma to the organs in the lower pelvic region. Lower appendages. If we do a side-by-side comparison, the lower appendages are always heavier than the upper appendages. Your femur is way bigger than your humerus. Your tibia way bigger than your radius and ulna. And again, that's because we're dealing with weight transference of the body. So if you looked at a cat, their humerus and femur would look very similar to each other, almost identical, except for the epiphysis parts. Where in us, very different distribution in size and bulk, because again, we walk on 2 legs instead of 4 legs. Now, our lower appendages have on average 30 bones, and if you know your chickens, you know how to separate them: the thigh, the leg, the stuff you throw away. I guess unless you're really hungry, then you might eat feet. I don't know. I don't want to give a pedicure to my dinner. Plus, it's not meat. If you're eating chicken feet, you're just eating cartilage and skin. Enjoy. I'm going to guess it's for the pickle, not for the substances. So our femur. So that's the one bone that is in our thigh. So our upper leg area. Again, not really leg because it's the thigh. It is the single largest bone in the human body and heaviest bone in the human body. Used to be used as a really good weapon because you could hold it towards the bottom and hit people with the top and like a little hammer. Okay, so and nothing terrifies neighbors more than running around with the femur to beat somebody with. That's got some street cred attached to it. Now, your femur is one of those coveted bones when you find skeletal remains. So the ossa coxa, you can obviously tell if it's male or female. The skull and parts of the femur and tibia together with the knee joint. The reason why they want the femur is that is how you can identify the height and weight of the individual. So again, if you've ever watched news shows or whatever, they're like, oh, skeletal remains were found of a guy who was 6 foot tall and 250 pounds. You're like, how did they know that it was a skeletal remains? What they do is have some math problems. You don't have to know the math problems, but if you were to take forensic science over on West Campus because you decide to be one of the popo, there are math problems for this. So if you want to figure out the height of the individual, you take the height of the femur in centimeters, you plug it into the math problem, and it's going to give you the height in centimeters within a couple. So fairly darn close. If you want to see the weight of the individual, the heavier you are, the more weight you put on the bones, the thicker your bones are going to be. So you take the diameter of the femur and do a math problem with that, and it's going to tell you roughly how large that person was, how heavy that person was. If they can't find the femur, the tibia is the next one for that, because the tibia deals with weight transfer, also can deal with height. You wouldn't want to use the upper limbs. The upper limbs, the humerus could tell you how tall somebody was, but they could not tell you how much they weighed, because it doesn't matter if you're big or small, your humerus is roughly the same size. So you're not going to be able to tell weight by looking at the upper limbs. You can only do that looking at the lower limbs. Yes, sir.
So will the femur grow? Let's say someone is, let's say they're kind of skinny and they get a little older and they gain a lot of weight. Mm-hmm. Will the femur grow with that weight?
Yep. Yeah. So again, that's why the funny thing whenever you was like, I'm not fat, I'm big bone. It's like, you're big bone because you're fat. So the more you weigh, the more stress you put on the bones, the thicker the bones are going to be. So you can tell somebody who was 6 foot tall and 175 pounds compared to somebody who was 6 foot tall and 250 pounds. They would have different girths, different thicknesses to their femur. The only time you'll get a skewed number is if you used to weigh 500 pounds and you got gastric bypass and now you weigh 150. It's going to take a while for your bones to lose some of that density. So there's going to be a few years after that massive weight loss that your skeleton still says big boy, even though you might have shrunk down a little bit. But it eventually will balance out and you won't put as much stress on the bones. If you don't weigh as much, your bones won't have to be as thick. So these are the good ones to pick up for weight distribution. If you have a whole person, the span of their fingertip to fingertip is roughly how tall they are. Okay, so you can always do that one. Now, your upper limbs can be problematic when dealing with height. If you start utilizing one side more dominantly, drastically, it will lengthen that side. So they've done studies where, in the Middle Ages and so forth, when you had kids started to learn how to do sword fighting when they were 5, when they were 6, on to adulthood, their sword arm will actually be a couple of centimeters longer than their non-sword arm. So that was something that they used to show that gladiators weren't all slaves. Some of them were trained ever since they were little to be gladiators. The more you use the sword, the more that arm is going to build muscle, the more it's going to pull. And if you're pulling on it while it's still growing, it gets longer. So today we don't see it as drastically because we're not teaching our kids to sword fight in elementary school. Why? I don't know. What could go wrong? But if you want your kid to be the next Andre Agassi, in case y'all still remember who that guy is, tennis guy. So if you teach your kids tennis and they do tennis throughout their childhood, their dominant arm will be bigger or longer than their non-dominant arm. So you have to do training extensively to get those differences in size.
2 centimeters, you say, roughly?
Right.
So would that be the same with your legs as well? You overwork one leg more than the other, or is it just with your?
It's just with the upper limbs because the way we distribute body weight, if your femur was a couple of centimeters taller on one side than the other, you're going to hobble. So it's the reason why John Wayne had a limp. One of his femurs was shorter than the other one. So that is oftentimes a defect with your growth versus an overgrowth to accommodate movement and such. As long as you're walking, you shouldn't have the disparity. Now, if you just hopped around on one leg your entire childhood, you would have a size difference. But then we really have to worry about that person. Like, why are you hopping on one leg all the time? Look at that, it's a femur. And you'll notice they always put it at an angle because it is an angle. It doesn't sit straight up and down. So with our guy, the acetabulums kind of, have a slight angle to them, so you will have that slight angle to the femur. With the females being broader, the acetabulum angle is even more downward facing, so it's going to create a greater angle. So this is another thing that you might notice. Females almost always look knock-kneed, okay? The only time a female doesn't look knock-kneed is if she got some thighs on her, but even though she's thick, they do knock-kneed. They do go in because the wider the hips, the more knock-kneed that individual is going to be because of the angle of the acetabulum. So this is why females get different knee injuries than guys. The angle of the femur coming into the knee, it sits different. So they're more subject to certain type of angular damage compared to the male because of the angle that they come in at. So in case you've ever wondered how come skinny girls look knock-kneed and skinny boys don't. Skinny boys don't got the hips. Okay, so the more the kids can get out, the more knock-kneed you're going to be, which is ironic because you would think you would not be knock-kneed with kids coming out.
Are guys more prone to have like bow-legged, to look more bow-legged?
That's usually due to poor ossification.
Okay.
So if they didn't get enough calcium during growth, then you can have those issues. Now, cowboys would be more bow-legged because if you're on a horse while you're still growing, you have to squeeze that horse with your legs so you don't fall off. So that's going to slowly bend you over time. So you can tell a cowboy skeleton from a city slicker skeleton if they started off early. We don't ride the horses that much usually. You make your kids at least get down every now and then. The patella. So the patella is a sesamoid bone, so it sits inside of the quadriceps femoris tendon. It's the largest of the sesamoid bones. This one is between the leg and the thigh. So some books will put it with the thigh. So when we see the picture of the patella in the lab book, it's right next to the femur. Some books will put it with the tibia and the fibula when they discuss it. It's kind of like the Rio Grande. Is it Mexico? Is it Texas? Yes. Okay, it's a little bit of both. So I'm not going to ask you, is it found in the thigh or the leg region? Because it depends. Is your knee bent or not? Which one is it more likely to be with? Now, if you quarter your chicken, usually it stays with the chicken thigh, and it's that weird little chunk that happens sometimes. Now, this one's kind of kooky. At birth, it is cartilaginous. It's a big chunk of cartilage. That's why sometimes you'll hear the myth that kids are born without kneecaps. They've got them, they're just cartilage. And of course, cartilage doesn't have blood going to it. Cartilage doesn't have nerves going to it. This is why your baby can crawl around on their hands and knees all day long and not suffer any kind of pain for being on their hands and knees because their patellas don't hurt because they don't have the ability because they don't have any nerves. If you try to follow your kid crawling after 5 minutes, you're like, oh my gosh, I'm going to die. Because your patella's bone. It's got blood. It's got nerves going to it. It's dealing with the pressure. And it doesn't like it, so it complains. So that's why kids are more flexible. They're more squishy. Now, this one will start ossifying when you start walking. And that's because whenever we walk, we pull on the leg differently than when we're crawling. So that quads is really going to engage to help us to straighten our knee and bend our knee and all that kind of fun stuff. So it's going to start pulling on the bone, stimulating those ossification centers. So the cartilaginous part is going to do endochondral ossification. It does all the way up to about birth time, so to speak. It doesn't do the epiphysis or anything like that. So it just is a chunk, so, since it's not a long bone. Now, one of the funny things about this little guy, yes, it has a cartilaginous core, but around the outside, we've got connective tissue, dense regular connective tissue, that will also start to ossify. So the patella does both. It will do endochondral ossification to ossify the center. It will do intermembranous ossification to do the edges. So it does both types of ossification.
Can you say that one more time?
It'll do endochondral with the cartilage in the center. It'll do intramembranous on the edges where the membrane is located. So it's a twofer. It doesn't do one or the other. Now, when you start ossifying, it depends on the kid. So again, if you've got a kid that's pulling up at 6 months, they're trying to walk away and escape, they're going to start ossificating at ossification centers at that point in time. If you've got a lump kid that wants to be carried everywhere and they don't start walking till a year, then they're not going to start ossifying. So a lot of times in the books, they'll say noticeable by 2 or 3, because by then your kids should be walking, and if they're not, put them down. Let them learn how to walk so they can, walk when they get older. Another oddity is when we hit puberty, you're done. So puberty, again, speeds up ossification for most of the major bones of the body. We have all those growth spurts going through. Whenever you hit puberty, the patella's like, and I'm finished. So it's done by the time you hit puberty. So if you hit puberty at 12, get your first period, mazel tov, you're done with the patella ossifying. Okay. This is why we see a lot more knee injuries in high school sports. So again, we see knee injuries in high school sports. We don't usually see that many in junior high or elementary school sports because if you're still ossifying, you're still a little pliable. If you're fully ossified, the bone doesn't wiggle anymore. So what takes the brunt of the stresses are the soft tissues. So it increases the chance of tearing. So knee injuries start in high school with those sports and then can obviously go through the rest of your life. In case you've ever wondered, how come high school kids get so many more knee injuries than middle school kids? Because they're solid. So what has to give her the soft tissues versus the patella. The leg below the knee. So if you have a peg leg, right, it stops at the knee. It doesn't go all the way up to your hip or anything. So it has our two bones. And as mentioned, sometimes patella will be listed in the leg section. Sometimes it's listed in the thigh section. So our first bone is the tibia. That is your shin bone, your crural region that you would use to find your coffee table in the middle of the night. It is the only bone to articulate with the femur. So it's going to deal with weight transfers from the femur to the tibia. Again, this is why we can use the tibia to figure out the height and weight of an individual. Now, some bone locations or landmarks, we have the medial malleolus. That is the inside ankle bone. So that's the bump on the inside. So it's not technically your ankle. It's a leg component. And then we have the tibial tuberosity. Again, tuberosity just means bump. So that is the bump under the knee. That is the anchor point for that quadriceps femoris tendon so you can kick people with your quads. So the bigger your quads, the bigger the tibial tuberosity because the more it's going to pull, which is ironic because sometimes you'll have people like, oh, I want to go exercise because I have bony knees. It's like the more you exercise, the bonier your knees are going to be because the bone gets bigger when the muscles get bigger. So you can't exercise away boniness of something like your knee.
And that is the tibia that articulates with the femur?
Mm-hmm.
Okay.
The fibula, okay, so again, some people remember this one because you tell little fibulas, or you can use tibia, tuba, fibula, whatever works for you. Now the head of the fibula is going to articulate with the tibia. So it doesn't articulate with the femur, so it does not deal with the weight of the body. So your fibula can tell you how tall somebody was, but it cannot tell you how heavy they were, kind of like the humerus. Since it doesn't deal with any weight bearing, you could weigh 150 pounds or 250 pounds. Your fibula would still be the same size. The fibula is there for muscle attachment, your calf muscles. So if you have big, thick calves, you're going to have a thicker fibula than if you've got the little stick bird leg people. Calves. Okay, so you look at the calf muscle, however big that calf muscle is an indicator how thick that fibula is going to be. The one location that we really have with the fibula is the lateral malleolus, so the little paddling end. That is the outside ankle bone that we see. Again, technically not your ankle, that is your leg. And again, malleolus just means hammer, which is weird because I don't really think of those as hammers. I think of those as something that would probably get hit by something. But that's what malleolus is. So there's some lovely legs there. So tibial tuberosity, medial malleolus, lateral malleolus of the fibula. And again, the fibula does not articulate with the femur. The fibula is not a part of your knee joint. So the knee joint is just your femur, your tibia, and your patella. The fibula just hangs out by it, but it's not a part of the knee joint. Your tarsus or tarsal bones, biologically your ankle, we have 7 tarsal bones. The big ones we talk about are the big ones, the talus and the calcaneus. So the talus is going to articulate with the tibia, and your calcaneus is going to articulate with the talus. The calcaneus is the largest of the tarsal bones. It is the largest of your short bones. And of course, these are big boys because they're dealing with weight distribution of the body. So if we draw a body, or at least portions of the body, did I pick the good one? I picked the good one. I know, not biologically accurate on that one.
You said the calcaneus is the largest of the
Tarsal
Tarsal
bones
bones.
and the short bones.
Okay, tarsal. I just said the tarsal and short bones.
So when we look at weight transference, we start with the sacrum, and it's going to transfer the weight from the axial skeleton to the ilium into the appendicular skeleton. From there, it's going to go through the acetabulum to the femur, from the femur to the tibia, from the tibia to the talus, from the talus to the calcaneus, and down to the ground. So that's why these guys have to be the two biggest ones, because they're dealing with the weight distribution of you, because we walk plantigrade. We walk on our feet, the flat parts of our feet. So again, if you were to take comparative anatomy, if you want to be a doctor, vet, whatever, the carpals and tarsals are some of the most studied bones in the bodies, because that's what's going to tell you how the animals are different. You can look at the femur of us and a femur of a dog, they look almost identical. But where the differences are is due to weight distribution differences. So when we look at a cat or a dog, they've got that crooked hind leg, and that's because their talus and calcaneus are elongated, because cats and dogs walk on their tippy toes. So they tiptoe everywhere. So they have weight distribution differently down there. So their tarsals are going to have different shapes to them. Same thing if you look at a frog. Their talus and calcaneus, which is actually called the astragalus and the calcaneus, are almost the same size as their tibia fibula, because they have that extra bend so they can jump. Right? And if you were to look at a horse, I'm not going to draw a horse, but they walk around on their middle fingers. They're so tacky. Walk all the time. So that's what hooves are, the nails that you get manicured, put a little shoe on them, make it look good. But they just walk around on their middle fingers. So their talus and calcaneus and the other parts of the tarsals and metatarsals look almost identical, because they're dealing with weight transference. So humans, this is why if you walk on your tippy toes all the time, you wear heels, it can be painful. And a lot of women complain about that after they wear heels. Their feet hurt. Why? Because this is supposed to be in contact with the ground, and if you're walking on heels, you're putting all the weight here. And these little guys are not made to deal with distribution. The cuneiforms are not big enough to deal with the weight of you. So that can cause a lot of foot pain and problems that way. So you'll see that a lot if you have heels and you wear them a whole lot, and then you go barefoot for a week or flip-flop or something. You get the pain because you're putting pressure on things you're not supposed to be putting pressure on. Because those bones, everything past the talus and calcaneus, the tarsals, metatarsals, and phalanges are just there for balance, so you don't have peg legs and you don't fall forward when you're walking. It's going to help plant you in place so you can distribute not so much body weight, but balancing. So that's why those two are so big. They're dealing with the weight of you, and the bigger you are, the bigger they are going to be in response to that. The Achilles tendon. This is how Achilles got his name, because that's what his mama held him by to dip him in the river Styx so he would be immortal. Now with the Achilles tendon, also known as the calcanean or calcaneus tendon, that it goes from the gastrocnemius to the calcaneus, and when the gastrocnemius contracts, you tippy toe. So Achilles, if he got proper wound care, would not have died from his injuries. He just wouldn't be able to tippy toe around the battle in case he was he wouldn't be good at it.